you know, magnifiers, and things like that that can help elderly people. Hearing loss is definitely something that older people suffer from. It occurs in 1 in 3 older adults. It is more likely in men, and it usually has an environmental cause. Okay, we are the ones that cause our own hearing loss. It's the #1 debilitating disease that is preventable. And we are really worried about our iPod generation because you're doing damage to your ears. So, you know, it can cause permanent hearing loss. You know, there can be problems of hearing particularly high-pitched tones. These are the women in your family. I know sometimes that we laugh because we think the older men are just not, or they're choosing not to listen to the women, but it's usually because of the higher pitch. You know, if it's a really noisy restaurant, or if the television is on and it's loud, it makes it difficult for these people to hear. Okay, and you know, hearing aids can help, but hearing aids can't usually select what that person wants to hear, so it just amplifies all noise. So a very noisy setting again is going to be loud in that person's ear, and they still may not be able to hear the person talking to them. So here's just a picture of the inner ear. This is our cochlea here, and then it's filled with fluid, and you have these tiny little hair cells called cilia, and they pick up on the vibrations of the fluid inside of the cochlea, right? So sound waves come in, they bang and vibrate here on the eardrum, causing these 3 tiny bones to vibrate and kind of fine tune that vibration on the oval window to the cochlea. Okay, and when the fluid vibrates, it causes the cilia to vibrate and send an electrical impulse down the auditory nerve over to your auditory cortex so that you can hear what is being said. If you constantly have really loud banging, because it's a loud sound, then the loud vibration, or the loud sound, will cause big vibrations, will cause big waves in the fluid, which can damage and bend the hair cells. And if the hair cells are damaged and bent, then smaller vibrations never touch the bent or damaged hair cells, and that's what causes hearing loss. So as you are young, right, we want to do things and live in a way that our older selves will thank us for. So avoiding high noise environments so that you don't damage the cilia, so that when you're older, you can hear. Okay, carpeting in the house oftentimes reduces that you know, vibration or that echo, and so can make it a little bit easier for somebody who has hearing problems. You know, replacing noisy appliances. They say a blender is too loud. Okay, that's a decibel that is damaging to your ears. Face the person when you're speaking to them, just to make it a little bit easier so they can see your lips move while you're talking. And avoid elder speak. Elder speak is where we kind of talk to older people as if they're a child. Okay, so instead of just raising your voice so they can hear you, you talk to them as if they don't understand you, and you really want to avoid that. You don't, they understand you, they just can't hear you. So motor abilities that we tend to see a loss of is just, you know, primary motor abilities overall, right? They just don't move as quickly. Their reaction time really slows down. So they can't, you know, catch something if it's falling. They may not be able to catch themselves if they're falling. They just have a hard time with that quick motor ability. Okay, so it takes them a long time to kind of respond to that sensory input. And then, of course, you can just have actual changes, osteoarthritis, right? Making it more difficult for them to move their hands, their back, their knees, and so on. Osteoporosis is that loss of bone density, right? Where our bones become porous and have big gaps and holes in them, making them more susceptible to breakage. Okay. So, again, right, vision problems, hearing problems, and motor abilities, overall, with an elderly person, you really want to be careful with them. Don't rush them. Try and get them to work on their strength and their balance. Help them in a quiet place and talk to them, and look into hearing aids if you think that will help. Maybe they shouldn't drive at night. Maybe they shouldn't drive in the rain where you get the glare of the lights. Okay. Oops. So driving in old age, if we need hearing and vision and reaction time to drive, then it's probably not the best idea for somebody who's having problems with those three things to no longer drive. We see here that elderly people over the age of 75 are more susceptible to passing away from an accident compared to your younger people. I just want to move this real quick. Well, it doesn't show it, but this is just accident ratios per age group compared to men and women. But we know that elderly people are more likely to pass away from an accident. And there could be a number of reasons for that. They're more likely to suffer a fatal car accident because if the reaction time is slowed, they may never have stepped on the brake. They may not see the car pull out in front of them, so they hit it full force. Once they're in a bad accident, they're more likely to have chronic diseases. They're more likely to have, perhaps osteoporosis, so that they suffer from some serious side effects and health problems once they get into that accident. I don't know why these are doing this. You guys hear my dogs barking? All right, so, trying to get a car away from an older person is really hard. If you've never done that before, that is not easy. So it's very hard on it's very hard on the families trying to do that. So, and the reason why is it's their freedom. They've been driving for 50, 60, possibly 70 years. And, it's their freedom, and it allows them to do things that's kind of their last sense of independence. And our society really is, we've got to drive everywhere, especially El Paso, right? That's not very walker friendly. It could cause them to have to go into a nursing home. How are they going to get their medications? How are they going to go to the store? And so on. So it makes them reliant on other people. And so that's your natural hesitancy for them to give up their car. Things that we in psychology kind of push for so that it's not up to the family, require them to go and do tests, have them do a driving test, look at their vision, test their reaction time. And if it does not, if they don't pass, then the state takes away their driver's license. And it's not something that the family decided to. It's just that, sorry, Grandpa, the state took it away. They say it's unhealthy, right? Or it's dangerous for you to drive. A little bit into the neurocognitive disorders. Neurocognitive disorders is a big fancy word for what you commonly hear out on the street called dementia. And dementia is just a little bit of an easier word for neurocognitive disorders. And dementia is a big umbrella. There's lots of little other types of diseases that fall within the realm of dementia. So Alzheimer's is a type of dementia. You can have dementia with Parkinson's disease, you can have dementia with AIDS, you can have dementia with alcoholism, and so on. Okay, so typically you see it in advanced or really old age, but you can in some of the younger years. Okay, it's irreversible. Okay, and let's see. Oops, I didn't mean to do that. Okay. So some of the things that we tend to see with dementia is definitely semantic forgetfulness, like a loss of words, a loss of events, okay? Impairment in executive functioning, so they're just not making the best decisions. You know, kind of an inability to think abstractly. Language, you can see again, losing words or things like that. And then eventually a gradual loss of all functions, and then that leads to death. So here it has, we have two main types of dementias or neurocognitive disorders, but certainly there are others. Okay, so this one, we commonly call it vascular dementia, but this is a vascular neurocognitive disorder. And this is where you have a series of small strokes, and this can impair the person's brain and ultimately cause problems in memory and language and executive functioning and so on, because of the small strokes that are happening all over the brain. Okay, this one is typically pretty difficult to, well, can be difficult to diagnose. It can be difficult to catch and notice just like family members. Oops. But certainly an MRI is going to show whether the person has had strokes. Okay. Alzheimer's disease is our classic. This is the one we think of. And so usually it's age related. You usually see it in advanced old age, although we do have early onset Alzheimer's that can affect younger people. You do see things like this plaque and neurofibrillary tangles inside of the brain. Okay, we do have neuronal decay. You have like an atrophy of the cortex. Patients typically have those classic signs of dementia. You have word loss, you have memory problems, and you know, that's just kind of like the classic that you see. They have seen a genetic link to that APOE4, and but that yeah. So, you know, they tried to focus on this this plaque that they saw building up in the brain. However, there was a whole kind of era of drugs that were coming out that were destroying this plaque. And what they realized, they had to in fact quit the studies because they realized that the patients were dying sooner and faster if you dissolved that plaque. So so that was I guess a huge setback for Alzheimer's medications. We still have no cure. There's really, you know, not very effective treatment. We do have medications that tend to help some of the symptoms, but it certainly in no way, you know, reduces the course or changes the course of the disease. Obviously, trying to detect it early can help. Trying to take these medications to help a little bit. We do recommend healthy diet. Physical exercise is one of the biggest ones right now that studies are showing. Physical exercise above health is really what's helping people to prevent Alzheimer's. So brain stimulation games and, crossword puzzles and things like that, those are good. They're always good to try and practice and keep yourself sharp. However, they don't tend to do much as far as preventing Alzheimer's. Trying to see, is there a steady mental deterioration? Is the forgetting getting worse and worse? Cognitive functioning, executive functioning, are they making bad decisions? Are they getting lost in their hometown? Things like that, those are signs to look for. Definitely want to take the person to the doctor to rule out that they don't just have a tumor in their brain or there's some other medical condition. Okay. It's always good to try and get some sort of, baseline performance in memory and executive functioning so that as you age, you can kind of see if there's something that tends to be accelerating that cognitive decline, and so that you would know whether you are having problems or not. If you're living with somebody or know somebody who has dementia or Alzheimer's disease, obviously sticky notes and calendars, reminders, things like that can always help. You want to make sure they're okay, probably shouldn't be driving at this point or leaving the house. You might want to put some sort of an alarm system or buzzer or bell on the door just to make sure if the person gets out, toxic substances, if they're not really able to work the stove and the oven anymore, you might want to just go ahead and turn it off because they can forget that they're cooking something and start a fire. It's a hard disease for sure. It's very difficult on the family members and the caregiver. It's hard to watch somebody just completely deteriorate to somebody who, you don't even know who that is anymore. They can experience abuse. Sometimes our dementia patients can become rather violent, okay? And so you want to watch out for that. Obviously stressed out, they can get depressed, they can feel guilt or embarrassed. So we really say for caregivers to get involved with the support group, really consider putting the person into a nursing home or, just a home for Alzheimer's patients, and so that just can really be a difficult thing for caregivers. Let's see, I'm going to skip over that. So these are just some of the different places. What can we do with our elderly people? Obviously, a nursing home is a possibility. Here in the United States, we're a little bit bigger on nursing homes. Our Hispanic communities and definitely communities that have roots in the eastern part of the world, Asian, African, Middle Eastern, are not as big as putting their parents in a nursing home. They usually bring them to live in the home with the family. But nursing homes are something to consider. Obviously, just like picking out a daycare, you want to make sure that it's good. It's a nice place, it's caring, and so on. If you walked into a nursing home, the most common person you're going to see is a elderly, very old person, and usually female. Not all nursing homes are just kind of a dumping ground for our elderly. Not all of our elderly are being abused, and not all of our elderly are cared for poorly before they die. Those are a lot of myths that exist out there. That's not to say that it doesn't happen. Of course it does, but probably not as widespread as you would believe. So Nursing assistants or a nursing aide. You know, these are the individuals that are typically on the front line caring for these individuals. You know, it's hard work for them. They're stressed. They can often also take the abuse from the elderly person. So we want to be mindful of that. It's a difficult job. Facilities are usually quite understaffed and they're usually not paid very well. So trying to rectify that, I think, would be a good thing for our society. And that is